My name is Debbie Gale, and I live in Marlington, West Virginia. I am 61 years old, and I have worked as a hospital pharmacist for 38 years. I have had pain in my neck for 20 years, and I have been told from pain management specialists and my neurosurgeon that it's partly genetic in that it's arthritic in nature or degenerative disc disease with stenosis, but also due to the nature of my work as a pharmacist where we stand bent forward a lot, especially with our heads bent downward over a prescription counter checking medication, and then also sitting at a computer with our necks jutted out and that type of thing. So just continual pivotal motion of, the neck and the head downward over the years caused me damage.
Though she dealt with the neck pain for decades, Debbie noticed that her condition was getting worse.
I have not been without pain since 2006. The chronicness of the pain. I would have intermittent pain, and I would take nonsteroidals and Tylenol. But in 2006, my pain became chronic, and it never left after that. And I started at a pain center, and I have received over, from 2006 till 2011, facet joint injections, occipital nerve blocks, had cryoablation done at West Virginia University Pain Center. And all of those treatments for me helped temporarily. It was like putting a Band-Aid on an open wound. I had actually seen neurosurgeons before, and they had recommended surgeries for me, but I was very frightened, and it didn't sound like anything I wanted to do. And so I just pretty much suffered with the pain because as a pharmacist, I didn't take opioids and that type of medication because it altered my, consciousness or ability to concentrate, and when I did work, I wanted to have a clear mind for my patients. So anyway, I basically stuck to the Tylenol and the nonsteroidals, which is like Motrin and Advil, but after a while, nothing helped me. And then eventually I became so compromised. I was laying in the bed 18 or 24 hours a day. I barely worked. I had a full-time job that I had to cut back to part-time or per diem or a few days a week or a few days a month because I was just in such excruciating pain in my neck that I couldn't do anything. And I actually was so distraught about what I was going to do and didn't know what to do or where to turn. The pain management wasn't working for me. I was seriously contemplating suicide.
Thankfully, Debbie ran into a new neighbor that told her about the Bonati Spine Institute.
So we had moved to this area. We had retired here, and actually my neighbor who lives down the road had her daughter to the Bonati Spine Center. They're from New Liberia, Louisiana, and once I got to know her a little bit and told her about my pain, then she highly recommended the Bonati Spine Center.
Encouraged after hearing her neighbor's story, she started doing her research.
When I found out about the Bonati Spine Center, I went on the website and was looking around, and I saw where you could send an MRI. Well, I had one that I could send that was fairly recent. And very quickly, someone called me about it. He's like, Mrs. Gale, I've reviewed your MRI. I see, some problem areas that you're having. And based on, the information, like you could type like a little text message that you've given us, then, we have procedures that can help you. Upon further discussion with my husband, we decided that we would travel there.
After traveling to Hudson, Florida from West Virginia, Debbie was impressed by the facility and staff at the Bonati Spine Institute.
And then when I got there, the first thing I thought of when I saw it, because it's such a beautiful center, it was like a place for like the stars or professional people. And everywhere I went in that center, everyone was professional. They were friendly. They had my best interests at heart. It was just good patient care. And especially being in the healthcare field and being at pain centers for several years, I was very impressed with the way that they worked me up in the clinic. And, he said, this is a thought process that we go through. This is how we determine what we feel like, based on what you tell us and what we see on your imaging, is your worst area, because that's what we want to treat first. And I found that really amazing too. And I thought, well, that only makes sense. I never expected to hear that. But that made sense, that they want to treat the worst pain first.
The exclusive Bonati spine procedures are performed under conscious IV sedation, where the patient remains awake and communicating with their surgeon to ensure the source of their pain is eliminated before they leave the operating table.
It was all done outpatient, and it was done under conscious sedation. I was laying there on the table, face down. The nurses were saying, Miss Gail, you're finished. Your surgery was successful. We need you to tell us about your pain. And to me, I was thinking pain. Well, I don't feel any pain, but what was just coming over me, and the feeling that I realized was that doom and gloom, that hopelessness and that despair that I had gone in there with, where I wanted to kill myself, that was gone. And I felt joy. I felt relief. And I started laughing, and they said, let me help you up. And I said, no, I can get up. I can get up by myself. And I walked out of that operating room, and I remember raising my hand saying, hallelujah, praises be to God, because I didn't know I was going to get that relief. I didn't know that they were going to make that kind of a difference in my life. I didn't know that. And that horrible, horrible pain that I had when I went in there, I've never had that again.
Patients of the Bonati Spine Institute are often surprised to learn they don't have to wear uncomfortable braces after surgery, and the only therapy required of them is to walk about an hour a day.
As part of your therapy, even on the day of your surgery, they have you walking. So I knew how important walking was. I like to walk anyway.
Debbie tells everyone she meets suffering with neck or back pain about the Bonati Spine Institute.
I have actually been passing it along about the Bonati Spine Center. What they did for me was just so monumental in my life that I have been sharing it with many, many people when they talk to me about their pain. And, certainly I'm not a neurosurgeon, but I know what they've done for me, and I can tell when somebody's in pain. I tell everybody that I know, everywhere I go, if somebody's in pain or they're thinking about surgery, and actually I've been talking to my dentist about it also, because he's had some nerve ablations and a hip replacement and needs some other, work done. And he told me that he was getting ready to call the Bonati Spine Center. I am not a paid spokesperson for Bonati Spine Center, but I personally speak to what they did for me all the time, because they did give me my life back.
Debbie is now enjoying her retirement with friends and family, pain-free.
And before I went there, like I said, I was in that bed 18 hours a day, and I didn't really want to live, but now I'm actually enjoying my retirement. My husband and I live in West Virginia, and we're in this area because, well, my husband was a park ranger, and so we retired to an area where has outdoor activities. We live on a river. We live on the Greenbrier River. We go kayaking in the spring, the summer, the fall. We have the Greenbrier River bicycle trail, or river trail rather. It's 75 miles, and we bike that. And I actually will walk that when the weather is nice, 3 and 4 miles a day. We are able to do more things together. We took a hike a couple of weeks ago down at Watauga State Park, and we hiked 4.7 miles up rocky terrain, and it took us 4 hours. And I would have never been able to do that before. But after the spine surgery, I remember that summer, because I had my first surgery in February, and some friends came up for the weekend, and we took a hike, and they're like, because that was probably 3-4 months after my first neck surgery, and my friends were like, oh, should you be on here? Should you be doing this? And I'm like, oh no, we can do this. I can do it.